Good morning, everyone. Thank you so much for joining us. I'm just going to take a minute here to let everyone start to join in because I know it just takes a minute sometimes with Zoom to enter the room. So I'll give everyone just a moment to get their screens up, make sure their audio is working. We know we're probably your first session of the day, so we really thank you for joining us in the morning. And I still see the participant numbers going up, which is fantastic. I'm very excited. But again, I just want to give everyone a chance to log on before we jump into our presentation. So my name is Grace Farber. I am the pre-health director here at the university. And so I'll be leading you through today's presentation. And I have some other people on the call here today. A few of our individuals from admissions will help us with the chat function, just in case any questions or concerns come up in the chat. And Elise or Gary, feel free to interrupt or let me know if something comes up in the chat that you want us to address. I will say, if you have any questions, I might just jot them down because you might find that we will address them throughout the presentation today. And we will have a Q&A session at the end. But again, you're always welcome to put your questions in the chat. You can also send them privately to one of the hosts, and we'll make sure we get to your questions also at the end. So thank you again for joining us. Good morning, and we're excited to talk to you today about our pre-health program. So first off, let me define what pre-health is. We are a health sciences university, right? Healthcare and science is our mission. And so pre-health for us includes, we have lots of healthcare programs, but the pre-health program that I am the director of and the individuals today who will be speaking to, these are students who are going to be a doctor, and they're going to be a doctor in a program outside of our university. So they're going on to places like audiology school, dental school, medical school, probably our most popular program, optometry, podiatry school, or to be a veterinarian. And so we are supporting these students in that journey. So today we'll talk a little bit about how we do that and what it means to be a pre-health student at USciences. So I have a fantastic group of individuals with me today. And right at the beginning, we're going to introduce you to our fantastic president, Dr. Katz. And I would say he is kind of the secret weapon in terms of our pre-health program. And as he'll tell you in just a moment, his background and what he has done for the pre-health program and the expertise he has brought to the program, you might notice he has MD behind his name. And so that means he is actually a trained medical doctor. And so I won't belabor it, but he'll tell you a bit about his expertise, and I think you'll see why having someone like him leading our university is so important. A little bit later, I'll introduce you to my colleague, Judy Chen, and then last but definitely not least is our student presenter, because we always want to give you a chance to hear from one of our students, Sophie Hockern, and so we're really excited for you to meet her. And please feel free to, if you have any questions that you feel like you want to hear from the student perspective, let her know at the end, and I know she'd be happy to answer those. So without further ado, let me introduce our president, Dr. Katz. Dr.
Thank you,
Katz.
Grace. Thanks, Grace, and really a pleasure to be with all of you today. Unfortunately, we're not together, but this is a good way for you to get to know us and us to get to know you. So as Dr. Farber said, I really feel very fortunate to be at the university. I came over as president 4 years ago. Prior to that, I had some really great opportunities, went to med school at Georgetown and did part of my training at the National Institutes of Health. And I want to bring that one up in particular because my NIH experience was one of the great parts of my career, since I had the opportunity to work for 4 years in the laboratory of Dr. Anthony Fauci. Now, I'm sure all of you have seen Dr. Fauci on television, his leadership role in the addressing the COVID pandemic, and he had a profound influence on me. More about him in a second. I also really was very fortunate to have the opportunity to help launch two new medical schools. The Commonwealth Medical School, which is now the Geisinger Commonwealth Medical School. I was the founding vice dean there. We launched our first class in 2009. And in 2010, I went over to become the founding dean of the Cooper Medical School of Rowan University in Camden. I got to know the University of Sciences in because we began doing some interprofessional education between our medical students there and the pharmacy students at University of Sciences, and that has continued. So I really have been excited during my past lives to welcome USciences graduates to my medical school programs, and I realized then how terrific the programs here are to prepare students for that. I also understood that there were some things that we could do to make this program even better, and we did so. And I'm really pleased to see the great impact we've had on our students. And you'll hear from Sophie, as Dr. Farber says. I want to mention one thing before turning it back over to Grace. Medical school applications are really going up, and what's referred to as the Fauci effect, regarding to my former mentor, Dr. Anthony Fauci. It's going to be increasingly important to be well prepared to apply to medical school or dental school or audiology school or veterinary school. And I know we can do that. One of the reasons I know we can do that is we developed a way to approach admissions to those professional schools. Grace is going to show you what we refer to as the secret sauce of how to get into health profession school. So Grace, back to you.
Thank you so much, Dr. Katz. So yeah, the secret sauce. This is really a way to say, how can we simplify this process? Because it is a lot. And we want to make sure we have a pathway for you that is clear and easy to follow and leads to success. And I'll talk a little bit about our success later. But the secret sauce, the 6 A's, as you can see them on the screen, we've got advising, academics, activities, admission test, application, and alma mater. We'll talk about each of them today. But the reason we put advising at the top is we sort of think of our advising as an umbrella to make sure that we can bring all of the other A's, all the other aspects of our program together. And as I mentioned earlier, I am the pre-health director, but I am not alone in my advising. And I want to highlight for a small school, which is what we are, the fact that I am not alone and I have my fantastic colleague Judy to work with. That's a really big benefit. A lot of schools, even very large schools, might have just one director of the pre-med or pre-health program. And the fact that you have two individuals, I think is really, really helpful because we are there as a team. It helps us make sure that every student gets supported and we support you in different ways. So briefly, I'll tell you about myself. I have a PhD in molecular biology. I'm also the co-director of the neuroscience program. So I come from a background that is an academic science background, but I have advised and mentored pre-health students for over 8 years. Now, what I've realized is there's a lot that you have to think about, and it can be overwhelming. And so, what I've done is created a pathway in terms of helping you set goals for the next 6 months to a year, helping you meet those goals, coming up with ideas, what works for you. And then, little by little, what you find is by the time you're ready to apply, you have everything you need. And I've got the eyes to say, oh, is something missing? And I think it just breaks things down. A good saying to kind of capture my advising approach is inch by inch, life's a cinch. Yard by yard, life is hard. And so my goal is to break things down for you, help you reach your goals without as much stress. And at the end of the road, I'm also just there to celebrate, keep in touch with you, and it's just a pleasure to work with our students and hopefully you one day. I'll pass things off now to Judy, who will tell you a little bit about herself and then our advising program. Judy?
Hi, everyone. Good morning. My name is Judy Chen. I'm the coordinator of pre-health advising, and my master's degree is in education, specializing in college student development. But before my graduate program, I actually was working in the healthcare industry as a recruiter. And so I learned a lot from that. And kind of my role on campus is really teaching students how to market themselves. You can do all the things, but you need to be able to talk. You need to be able to tell people why they should choose you for their graduate program. And so again, our secret sauce, we're really excited to tell you a little bit more about it. So With advising, we want you to first know that it is very individualized. Again, the fact that there are two of us at our institution allows us to make this really individualized to who you are. So if you look at this Venn diagram on this page, we want to start with what you love. And I think sometimes students go from high school to college and think, I don't have time to do the things that I love anymore. Well, we always come back to that because sometimes it's your hobbies, it's the things that you make time for that really show through in your interest in healthcare. But then in addition to that, we want to think, what are you actually good at? I can get paid for this. And the really big one right now is thinking about what the world needs. We're having a lot of interesting conversations with students about how they want to take their knowledge, their experiences, things that they have yet to learn to be able to solve real world problems. And so that is really the sweet spot in the middle is that star. And that is a journey. That's not something where you start college and you immediately know that. And so hopefully, Sophie can share a little bit about what that looked like for her. And you can see here, normally when we would be meeting one-on-one in person, but now we're doing virtual meetings, which is still just as effective, talking to students about what their journey looks like, what they need to do to prepare. Now, in addition to the individualized advising that you will receive, we have a pre-health community. It's very tight knit. You will know each other even from day one. And so when you are starting college, it can be really intimidating. So we want you to know other pre-health students on campus. You're going to recognize each other in class. But we're really proud of the fact that we have some awesome speakers who are actively seeking out USciences students, especially those in admissions at different schools, and they see the caliber of our students and then ask, how can I get in front of more of your students so that we get even more applicants? We're also very hands-on in the workshops that we lead. So even just this week, Dr. Farber and I were leading a branding workshop for students, juniors, who are going to be approaching the application process. And so there's a full year of preparation for you to figure out, is this the cycle I want to apply? Do I feel prepared? What does that timing look like? And in addition to that, some things that we're also really proud of are we have an internal website, a monthly newsletter where we're sending a lot of updates to students. And so you will not miss out on a scholarship. You will not miss out on an internship deadline. We will send that directly to you. And a lot of those opportunities are ones that our previous students have taken advantage of. And so as we continue to kind of build our database and know these are some really prestigious internships and research opportunities, we want our students to know about that. Now, we also in the spring will have a health professions fair, and that's usually 40 to 60 schools who are, again, actively seeking out our students. We've had students who, even as a first year, can start talking to admissions folks on our campus. Why? Because they're interested in USciences students, and they know right away, this is what I need to be doing over the next few years, and this is my dream school. So again, a lot of individualized advising, but also as a pre-health community, there's things that we're doing at large. So next, let's move on to the next part of our secret sauce, academics.
Thanks so much, Judy. So, academics, we thought it would be helpful to kind of start you with what does it mean to be a pre-health student? So, whether that means you're thinking pre-dental, pre-medical, pre-vet, really what that means is that schools are looking for a mixture of coursework and activities that demonstrate the coursework demonstrates you can handle the rigors of our professional program and you have the foundations needed. Whereas the activities, which I'll talk about in just a minute, show that you know what the career is you've gotten into, you have relevant experiences, and so you're not going to join the professional school and realize, oh, this isn't for me. You're going in kind of eyes wide open. So academically, most of you would be taking courses in biology. You'll see here several chemistry courses, physics, behavioral sciences, which are things like sociology, psychology, and then writing and English courses. Now, this can differ a little bit. So, for example, pre-vet students would be probably required to take some animal-specific biology courses. But these are the general set of courses that these professional schools are looking for before you apply and do their admissions tests. What I really want to focus on, though, right now in terms of academics is that core set of courses is not major specific. So what that means is you can be any major you want, and I want you to do that. Because if you say, I'm going to be this major because I think that's the pre-med major or the pre-vet major, what could happen is you end up in a major where even though you take those core courses, your other electives may not be things you love. And unless you love it, going back to what Judy said, you have to do the things you love because that's actually what motivates you. So if you love the humanities, be a medical humanities major. If you love statistics and quantitative analysis of physics, be a physics major. Whatever major you think aligns with you, be that. Our majors are either automatically built pre-health or they have tracks that make sure you get all of your necessary prereqs. So that's one thing also we're very excited about being a science university that we can offer to students is you don't have to be a bio major or a biochemistry major, for example, in order to be in our pre-health program. Now, I mentioned that besides academics, the other thing schools are looking for are your activities. And so your activities, again, are showing them that you understand the field that you are entering and you have certain skills and what they call professional competencies like communication, ability to problem solve. And so there's kind of two things I want to focus on for our university and allowing you to get activities that are really experiential learning activities. First is our location. So you get a small school, but you get it in a city, and that gives you accessibility. So right down the street, you can walk to several hospitals like the VA hospital, CHOP, the hospital at the University of Pennsylvania. There's many organizations, nonprofits. So there are so many chances to show how you want to give back to others, and it gives you a diverse amount of options. So again, you can do things you love and not just what's close by, what is accessible to me. You'll also notice some students here doing some hands-on activities. We are, again, fairly close. I would say about a 10-minute drive, 20-minute drive max to the Philadelphia College of Osteopathic Medicine. And for example, some students get to go to their neurosurgery symposium every year. Here you have students in our pre-medical society learning how to suture and place IVs. And these are opportunities where Judy mentioned earlier, there are groups, there are medical schools that want to recruit our students. So they'll even come on campus and run these workshops. And so our students have not only opportunities right outside of campus, but even on campus. The other thing, because we are so focused on science and healthcare, is that our faculty, there are so many opportunities for research. If you go to a large school, and I can actually speak to this because I did my PhD at a large school in Pennsylvania. I'll leave it at that. I don't want to call out one of my alma maters, but I do remember when I was a PhD student how difficult it was for undergraduate students to get into research. Whereas at USciences, every student who wants an opportunity to get involved with research has that opportunity. And that is something that is very attractive to professional schools as it shows that you've learned critical thinking, problem solving, resiliency. Um, and it's just, again, small school with really, really great opportunities. So at this point, Judy kind of alluded to this, that we have this year of getting you ready when you think you might want to apply. And so we've put the next two A's together, admission test and application, because they do happen in the same year. And Judy's going to walk you through what we do for our students when they think they're ready to enter that cycle.
Yeah, so everybody hold on tight. We're about to just fast forward through time. Hopefully, as we were talking about academics and your activities, maybe your mind wandered and you were imagining what that was like. You've already done all of those things. So when we're getting you ready for the actual application, what we love doing is helping students gain confidence in talking about those experiences, not only in writing with the personal statement, but through mock interviews. We love doing mock interviews with the students, and we do a lot of them, but we also get other faculty and staff involved, which is really great because if they actually don't know that much about the candidate, they can really pretend to be like an admissions committee and give them that real feedback. And it's not, oh, because I know you, I know this is what you meant. So that's really important that they get a lot of different feedback from different folks, especially those of you who might be interested in maybe an MD, PhD. I know that feels really far along, but we have students who do it. So in addition to those hands-on workshops that we've been talking about, we also are providing a lot of help with the admissions testing. I know MCAT sounds really scary, really far away, but we want to simplify the process a lot. We have an entire guide that we've created with the help of our upperclassmen, and they give us their pro tips on what has helped them. We also provide a one-on-one mentorship or even some group mentorship that are upperclassmen, before they leave, they're like, I want to make sure that underclassmen know how I prepared for the MCAT. And really that gives them a leadership opportunity as well. We also have a lot of partnerships with different test prep companies. And so they'll offer codes, they offer different strategy sessions. And again, it comes back to the idea of very individualized. We have some students who, work different jobs and know that through all of their activities, I might not be able to get most of my studying in until certain breaks. And that's okay too. It's really important that we know what all is going on in your life so that we can help you set realistic goals and your study strategies. So then, in addition to application, let's talk about bringing it back to this idea of it's important to know who you are. And people really don't care about what you do, they care why you do it. And so that might show through with what you chose as your major, what you chose as your minor, what research that you got involved with, why you got really excited with some elective course. That might be something that you bring up in interviews later on. But also, it's your exposure to healthcare and especially interacting with folks in the profession that you want to pursue someday. It would be so hard for you to say, I want to be a doctor, but I've never spent time with a doctor. And it's just, I hear about the things that they do and I want to become one. And so that's really not the narrative of our students. They get really active in figuring out, do I shadow my own pediatrician, my own dentist? I had to network to find a specialist in an area that I'm interested in. At the end of the day, your application, what you made time for, needs to tell your story and nobody else's. So I know we've kind of built this up a lot, but now we're going to pass things off to Sophie. And I think that will really help illuminate some of the things that we've talked about because she's been on this journey with us for years. So Sophie, take it away. Share us more about you.
Hi, everyone. My name's Sophie Hockren. I'm a fourth-year neuroscience major, Spanish minor here at the university. And I just wanted to tell you a little bit more about my journey, kind of starting where you currently are. So my first open house at USciences, I saw a presentation very much like this. I heard from a fourth-year student very much like me, telling me about all these interviews they got and all these acceptances they got. And I was like, okay, I just need one. So I don't know if this actually works, but I'm going to try, and I think this school can get me there. So if I can say anything to my open house self is absolutely make that decision. Since the first day I've stepped on this campus, somebody has been standing next to me, going through every part of this application process, every part of becoming a pre-med student, taking the prereqs, taking the MCAT, figuring out how to write a personal statement, because I had no idea, figuring out how to interview, figuring out every single step. And it just takes that extra piece of stress off of you so that you can find that story for your application. So as you can see from some of my pictures, global health and global mission work is very important to me in my life. I've been able to start a nonprofit while at USciences in order to make this part of my lifelong career. That was part of my application that I wanted to highlight extremely well. And I feel like I was able to do that. And hopefully the schools that I've been accepted to also agree to that. But I've been able to just be at this school and go through this process and see my other fellow peers at other schools just struggling through figuring out how to take the MCAT, figuring out how to interview, while here I am being able to find my passions, grow my work and things like that. I did come into this school knowing that global mission work was something I love, but what I didn't know was 4 years later, I'd be applying to programs with public health degrees as well, because throughout my time here, I've been able to figure out that I know what I want to do in this world and I'm ready to do it. I just need to get to where I want to go. And this school has got me there. So if I can give you one piece of advice for your next 6 months, it will be to apply to USciences. And once you get accepted, to accept that offer, because it's hands down the best decision I've made in the last 4 years. And I'm going to hand it off to our wonderful president who's going to finish the presentation.
Thank you so much, Sophie. And again, congratulations on your success. So we've talked about the 6 A's, but I want to talk about one for a minute that you may not think about as part of our formula, and that's Alma Mater, or where you went to college. So imagine you're an admissions office at a medical or dental or veterinary school, and you're receiving an enormous number of applications. And I think this year, as I mentioned earlier, there will be even more. So one of the things that admissions offices think about is where you went to school. Not all colleges and universities are the same. And med schools, dental schools, veterinary schools want to accept a student who they know will be successful there. That's extremely important. And having been on the receiving end of admitting USciences students, they are extraordinarily well prepared. You know, I've had the opportunity to go back and lecture at the Cooper Rowan Medical School. And when I do that and talk to our students, they tell me how well prepared their time at USciences was and how they're totally ready to adapt and to take on the rigors of these professional schools. And we've had great success in that. And the next slide, which I think Grace is going to show, really speaks to that. And this is just a small portion. So again, all those A's are important, but don't forget this last A, and that's where you went to school. USciences prepares you for entry into a health professions program.
Thank you so much, Dr. Katz. And this slide, what we wanted to show you was where our students have gone. This is not actually comprehensive. This is just a smattering of the places our students have gone in the last 2 to 3 years. And what we have been so happy about is our alumni network. What we have realized is our students feel so connected to each other and the students coming up after them that what we've been able to do is in that interview year, and Sophie, I know, you know, this is, I'm going to be adding Campbell Medical School because that's where Sophie's going. And so she's going to be part of this alumni network. And so what we do is when someone gets an interview, for example, we reach out to our students who interviewed there or were accepted there and went there. And we say, hey, would you talk to this student, give them information? And our alumni are just so helpful. They do panels, they connect individually. And this is, gosh, I just think this is so important to highlight that. I think when you hear about pre-med or pre-health, you sometimes think of this competitive, cutthroat world. And I don't think we have that community here. I think we have really built a family of students who realizes that by supporting the person next to them, everybody can be successful. There are enough seats for any student who is qualified. And so we just have this amazing group. And I'm sorry, I'm a bit of a soft heart. Hearing Sophie talk, I started tearing up because I love working with our students, and I hope I get to work with you and just seeing them through this journey, continuing on with them when they're alumni. It's just an amazing joy of my life. And again, I just want to end with, we hope you join this family. We hope you join this community. So at this point, we are finished kind of talking at you. But one thing I do want to highlight on this last slide before we open it up to general questions is that on our Instagram, if you want to hear a bit more about Sophie, her day-to-day, what her motivations are, Flo, Samir, or Chandat are also 3 of our alumni who are currently in medical school. Please check out their Instagram takeovers. They're right in the main story areas. If you just scroll and find their names, you can take a screenshot of this if it's helpful. And check out what their journeys were because every one of our students does have a different journey. And just seeing what everyone did sometimes can allow you to say, what seems right for me? What path, what experiences, and some of that resonates. So again, thank you so much for your time. I'm going to actually stop my screen share, but I do want to say, and I'll put this in the chat as soon as I'm done sharing, is you can reach out to us at any time. We have a prehealth@USciences email address, which I just put in the chat, and Judy and I both check that. So that's helpful if you're like, I'm not sure who to send my question to. And worst case, if it's not even one of us, we'll get it to who it needs to be. Oh, thanks, Judy. You did the same thing. All right. So, if anyone has any questions at this point, what we'd ask you to do is go ahead and enter them in the Q&A or the chat, and we are happy to take them.
Thanks so much, Grace. And hello, everybody. My name is Elise. I'm a member of the admission team. And so, Grace, I'll get things kicked off by a question that we get typically as when we're working with first-year applicants to USciences is how do I actually become a part of the pre-med program? Because you don't have a pre-med major. So how do I actually get into the pre-med track? How does that work?
That's a great question. So first off is sometimes when you fill out your Common App or you're working with your admissions counselor, it'll come up in that. And so we are able to see students who right away say, I want to be involved. But then what we do is in the summer, before you start USciences, you go through these what are called a summer orientation. So we go into the orientation and we say, if you want to sign up for this, and we give you a quick link to give us your information. And then lastly, when you join and you're in your first semester, we go to your orientation class, which is where you're really learning about your major, resources at the university. And again, we give you the chance to kind of opt in. You also have a chance to opt out if your journey changes, but once you opt in, we can basically tag your profile. So that way we know, for example, Susie is following a medical school preparation, or maybe Susie's exploring. We don't even need to lock you into a specific area if you're not sure. But what it does is it allows you to get those newsletters Judy talked about. It allows you to get any communication that we're sending out that's relevant to areas that you're interested in. So that's a great question. So we have kind of 3 touch points with you throughout to make sure that you are part of our program.
Thanks, Grace. And another question that I've been getting from students is, so during these COVID times, it's become a little bit more challenging for students to get the hands-on experiences or, the shadowing experiences and things that they normally would have done in high school to maybe figure out the type of profession they want to go into. Do you have any recommendations for students as they're going into their maybe junior or senior year?
Sure. Actually, Judy, why don't you? So, Judy is the individual who maintains our newsletter and website. So, I think she can really speak to how we've adapted to make sure our students are still able to get opportunities even with these limitations.
Yeah, so as we mentioned before, academics is really important. And so actually, whenever we go into those orientation courses, we always tell them before you add things to your plate, actually figure out what does it mean to be a college student at USciences. And so when a student is ready to get those experiences, and if, for instance, it's during the pandemic and you're finding that you're not actually able to shadow the folks that you want to, I think what we've heard is a lot of students are aiming for the nearby big hospitals. And actually, if you were to reach out to somebody in private practice, there might be less hoops to kind of jump through, starting the relationships organically like that. And so it might even be, this semester they're not able to take any students, but starting that relationship. So next semester, hopefully with the vaccine and everything, maybe things will look very different. But we've also been showing students where they can find virtual shadowing. And so there's so many different specialty areas. And if a student doesn't know, what's the difference between dermatology and gynecology, at least there's content that's available on demand virtually. There's a lot of Q&A sessions. They offer quizzes and things that's very engaging. And so that isn't something comprehensive where by the time you apply for school, you would say you've only done virtual shadowing, but it at least shows your interest, where during the pandemic, knowing that you couldn't actually go into a practice, you were still continuing to learn that way. So it's definitely not just because their doors aren't able to be open to you right now that you can't learn, but at least it gives students a sense of when the time is right and I'm able to shadow somebody, do I actually know who I would want to seek out?
And I'd like to add just 2 things to this too, some other opportunities that we were able to. So on our website, we actually made basically a COVID specific area and started adding things because we knew these limitations. So for example, we found a lot of service opportunities. So individuals who want to go to professional health school, you have to show that if you say, I want to help people, that needs to be a part of your life, right? You can't just say, I want to help people and not have the experiences to back it up. So there's actually a lot of virtual. So for example, we have an applicant this year who worked all over the summer with the crisis text hotline. And so we found opportunities and shared these with our students that were remote. We also promoted opportunities that are clinical that have not stopped. So for example, even though shadowing is more limited, scribes are very much needed. And so we actually had one of our scribe company partners come and give a talk to our students about how to make your schedule so that you can get a scribe position, because oftentimes it's the scheduling that's the difficulty. And so this has opened up some doors for students. And again, every student has different limitations, but for those who are able to go out, they are able to take maybe just a slightly different path than they might have thought they would have with shadowing.
Thanks so much, Grace and Judy. And so we had a question that came in on the Q&A. So I'm a current pre-medical student at a different university. Therefore, as a transfer, would I be placed into the pre-medical program from entry?
Absolutely. So one thing I'm very proud of and I just absolutely love is I think we're really transfer friendly. And one part of that is we have a transfer mentorship where when you come in within the first few weeks, we actually have you meet with other transfer students, specifically other pre-health transfer students. They give you their contact info. Again, our students have always been really supportive of each other. And so I think it's like pay it forward is they got the help, so then they want to help the next student coming after them. So that's been really great because our transfer students, one of the students actually, her video is online, Bronte. I mean, just hit the ground running. And I think a lot of that is the peer support. So not only do you get the support from us, but that peer mentorship.
Thanks, Grace. And we had a question come in the chat. So maybe Dr. Katz, if you want to tackle this one, due to COVID-19, will next year incoming students be taking their semester courses online or on campus?
So Hussein, thank you for that question. Last spring, we decided that we needed to do two things. Number one, keep our university community safe. And number two, continue to deliver the same great USciences education. And we've been extraordinarily successful at that, including the fall semester. So we're going to be doing the same thing we did last fall in this spring, which is a combination of in-person experiences, which will be laboratory experiences. Our students in their clinical rotations will continue those, but we're very optimistic about next fall. And the reason we are is primarily to do with the vaccine. And I think when we look at the timing of the vaccine, assuming it all goes according to plan, we think there's a great chance that all of our incoming and current students will be able to be vaccinated before the fall semester starts. So while we can't guarantee that, our desire is to be back on the ground and in person, in part because we think not only is the academic and educational experience important, but the college experience is important. Being together with individuals, continuing to learn in groups. So that is our intent right now, pending on the vaccine and the pandemic, but that's the goal we want to attain. And I'm pretty confident we'll get there.
Thanks, Dr. Katz. So we had a couple other questions come in on the Q&A. So we had a question about early acceptance programs. Can we apply to more than one at a time? Example, 3+4, 4+4 affiliate programs with LECOM for the DO and the DPT program. So I can address maybe the two different types of programs. And then Grace, if you want to address the affiliate programs.
Absolutely.
In regard to your major at USciences, we ask that you select one major on your application. So whether that be the physical therapy program or one of our pre-med preparatory programs, you can always change your mind. That is okay. And we know that for some students, they may choose to choose a different major, and that's totally okay. And what you want to do is you'll just want to make sure that you're working directly with your admission counselor. You probably have received some texts from us already. And if not, you'll learn more about your counselor in the admission session in just a couple minutes. But in terms of your major to USciences, we ask that you select one major. And Grace, I'll throw it over to you for the affiliate programs with the pre-health options.
Absolutely. And I'm going to put in the chat right now, it's there for you. For any students interested in partner programs or like what is a partner program, that's a link. We have partnerships with all of the areas we mentioned, audiology, dental, medical, vet, optometry. What a partnership program does is if a student is in the partnership program, it gives them a pathway to, usually it's a guaranteed interview. We have great success with the guaranteed interviews being acceptances, but it is a guaranteed interview most times. Now, since the question specifically addressed a 3+4, 4+4 program with LECOM, that is a direct application. So you're actually applying to LECOM. Their admissions team is evaluating you completely. We are not making that evaluation. We are just happy to accept you. And, if they say you're in the program, we're here to support you on your path to then that program. That one is an interesting one because it's called a provisional acceptance, meaning if you maintain their requirements, you have a guaranteed spot in their medical school. 3+4, the 3 means you're at USciences for 3 years, and then the second 4 is how many years you're at medical school. 4+4 is the more traditional path where you complete your degree in 4 years and then move on to medical school. So I would encourage any student who's interested to check out the link in the chat, and then you can email us at prehealth@usciences.edu if you have other questions. In general, you are applying to one program because the reason you're applying is you are very interested in that school. That is, it's what's the analogy? It's like picking your spouse, right? You're kind of saying, I'm really into you. And so I'm going to focus my attention on you. I do usually tell students, don't pick a school because of partner programs. Pick a school because they have a great pre-health program that you feel comfortable with and you feel like you can work with. Because our goal is for you to not just have one interview. Our goal is for you to have multiple interviews and acceptances and get to pick. And I do have to give a shout out to our current student applicants, including Sophie, who have multiple interviews. And oftentimes, I mean, we're only like not even halfway through the acceptance cycle, multiple acceptances, and Sophie is an example of that. So that's my goal for all of those students listening is have your choice, have your pick. And I do want to highlight too, if anyone has any student specific questions, please let us know because I know Sophie would be happy to address those.
There's one thing that I do want to add. If you are considering, the DO path or DPT, again, if you email us, I would love to chat with you, because if there's resources I can direct you to now that gives you some clarity with which program do I want to apply to, that would probably help you. But we've also had students who were accepted into one of our direct entry programs. They started classes and then they realized somewhere along the way, I'm actually interested in one of these early acceptance programs. And so that's something that you might be able to consider later. And so again, we can talk you through those options.
Great, thanks, Grace and Judy. So Sophie, we actually had a couple questions in the Q&A that I'm going to direct toward you. So 2 questions here. So if you had to describe USciences in one word, what would it be? Maybe one or a couple words if you can't narrow it down to one.
Yeah, I'm gonna probably be a little cliche here, but I'm gonna say proven. And here's why. Yes, it's in the slogan. Yes, it's everywhere, all over campus and everywhere, but it's an absolute fact. If you step foot on this campus, if you meet any sort of faculty member, any sort of student, you can see why USciences is the way it is. We're passionate about healthcare. We're passionate about getting you where you want to go. If you're looking to be in the healthcare field, this is the place that it's proven to be. So that is my cliche answer to that.
I love that, Sophie. And then another question that I'm going to direct toward you. So we had a question about what would your schedule be like and are there evening classes? So can you just tell us a little bit about what your schedule's been like over maybe the past couple years?
Yeah, so they're often very different. So freshman year, you're pretty much with your peers the whole time. You take a lot of the same classes as all the other freshmen, which is pretty nice because you can kind of form that community and figure things out, but they're mostly during the day. I did have a few labs that were later in the evening. You'll see our labs are typically 3 hours, so they're kind of a big chunk of time. So if they're spread out at different times, they can be in the morning, evening, or in the middle of the day. But as you go out, you get to kind of pick your schedule after that first semester, so you can really form that to what you need to be. I am a student athlete on campus, so it was important for me to figure out what time my practices were and how I can schedule classes around that and when I have meets and things like that. So it's very flexible after that first semester. So whatever you need it to be, it can be.
Thanks, Sophie. And I'm going to have you do one more follow-up question. How many classes do you take per day and per week?
So I think the most I've had in a day is 3 or 4, and that's on the higher end, I would say. But a week, you have typically about 5 core classes that you take spread out, and sometimes it's more, sometimes it's less.
And actually, I just want to jump in because I think it's important that number 5 that Sophie just gave you, the reason she gave you that is pre-health students usually stay at 15 credits or higher because they are showing schools that they can handle the amount of coursework at the same time so that they can then handle the rigors of the professional school. So I send out guidance during registration time to our pre-health students with maybe courses to look out for, but then that's one of the pieces of guidance is make sure you stay about 15 credits or higher most semesters so that a school doesn't look at your transcript and say, oh, well, this student was taking 12 credits every semester. How do we compare them to a student who is at 15, 16, 17? So that's actually a deliberate part of being a pre-health student.
Wonderful. Thank you all. And I did want to address the last question that we got in the Q&A because we are right at time now. So we got a question about transfer credits and discovering the transferability of classes to USciences. So I'm actually going to put a link in the chat right now because I suspect that some of you, probably the other participants in here, may have that question as well. So feel free to check out the link in the chat. You'll see a tool that we use, our transfer credit tool, where you'll be able to type in the institution where you took classes and see all the classes that we accept for credit at USciences. So that's a great tool to check out. And as you know, the information to contact the pre-health team is in the chat. So please feel free to reach out to our pre-health team. You can also connect with the admission office. The email address is also in the chat. And thank you so much to our presenters. Wonderful job. Makes me want to join the pre-health program.
Thank you, everyone. We would love to have you, Elise.
Wonderful. So to all of our participants, thank you so much for joining. Our next admission session will begin in just a couple of minutes at 10 o'clock. So feel free to take a break, get some coffee or tea. And we have the link in the chat for you to go to the landing page. There are going to be 2 different admission sessions, one for first year students and one for transfer students. So please make sure that you're going into the correct session. We'll hang on for a minute or two if you have any additional questions, but thank you so much for joining us today. We look forward to seeing you in the next session.
Thanks, everyone. Special thank you to Sophie, too, for making your time today. And those of you who are still in the session, if you have any questions about how to get to your next session, please let us know.
Looks like we